10 plus 3.5 now in that. So this is what it looks like. Over here we show them 3 books because we think that utopia living is good chiropractic, diet, exercise, pure water, and good sleep habits. That's what gives you utopia living. Now those 3 books is Chiropractic: A New Beginning, which is a book that I wrote years ago that explains chiropractic to a layperson. The Fountain of Youth is a book that shows you everything about the exercise that the people do over there in Tibet that live to be 80 to 120 years old. And I think Fit for Life is one of the best books that ever was printed on how a person should eat. 65% of your diet should be fresh fruits and vegetables. And of course, you should drink water that is purified. Now probably the best thing for water is reverse osmosis. That probably gives you the best things out of water. You should even shower with water that is filtered. You should not have that chlorine and stuff like that going into the biggest organ you have, which is your skin. And that's basically that part of it. The spine is your lifeline. Scientific analysis is vital. That means you don't want someone just palpating on your spine and twisting you with no rhyme or reason. Then I take the neurological deficit chart and I take an x-ray. Now of course people say, Piers, you don't do that. This is true. I don't do nothing. When patients come to me, they're already sold on me. I don't have to sell them nothing. So you don't practice like I practice. You practice like I used to practice. And I made these things so people like Kenny Guzik wouldn't starve to death while they're building a practice. Number 1, I show them what the normal neck is. Then I go through here and I find a neck that's exactly like theirs. And there's not a neck that you can't find in here. And then down below, this was actually put in here for patient education, but that isn't true. This is put in here so you'd know what I think. So that when you look at a patient, you don't even have to look at your notes anymore. This will tell you what I think. Lateral cervical curve is normal. The lower cervical curve is normal. Upper cervical curve is straightening. Degenerative changes between 5th and 6th cervical indicates no whiplash injury. The atlas looks structurally superior. I suspect locking at the occiput atlas axis area in flexion. If this occurs, the atlas is functioning as an inferior subluxation with respect to the occiput and is also probably locked in extension. I'm telling you everything you need to know right there. And then I show the patients how bad they are. And then using the arthritic rule and everything, I come up with neurological deficits. Now I did that for you yesterday. We picked out things that the atlas was locked for 32 years. And I come up with this number. Then I start tracing their lifeline form. If a person was born breech birth, they don't even start out on the line. So I take a green felt pen and I mark on here. And did you give them a copy? They have a copy of this? No. Don't we have them? No. I mark on here breech birth. And I start their line out below the lifeline. I said, you started out in the hole. You weren't normal to begin with. Then I take that line down, running it parallel to the lifeline, and their history shows me that they had a severe accident at the age of 5. See, 40's marked here. And whatever their age is, I mark it on here. So let's say they're 32. I put it there. They had an injury at 5. I drop them another ½ inch off the line. And I'm running parallel down here. I'm running parallel down here, below the line. Now at the age of 12, they were injured playing football. I drop them down again. And at the age of 20, they were in an automobile accident. Now they're down here at the age of 20. And from then on to the age of 32, they have nothing. So now I have them here. Their line is coming down here in steps. At the age of 32, they're about 3 inches off the line. Now down here is a tombstone. Now nobody has to be too smart to figure out if they're running this way, their tombstone's going to be moved over here. Now, I don't know one person that likes to hear that. Then I say, here's where you are on the life scale. Now, what is it you want me to do for you? Do you want me to only correct the problems that I found from this automobile accident? Do you want me to correct everything? Do you want me to bring you back to this line? Do you want to go above this line? I'm a cafeteria. The decision is yours. You go through the line. If you only want to eat Jell-O and cottage cheese, that's your business. If you want me to give you a 7-course meal, that's your business. What is it you want from me? I can give you any of these things. Now you have this many neurological deficits. Now all these things I'm going to try to correct. So let's do one. We'll do a person here. There'll be a rule up at the new place, and anyone dirties the board has to clean it before they're allowed out of the room. And if they take the things off of there, they'll have to put them back. Unless it's me.
Oh, I was going to say, does that go for everybody?
Okay, now, here we are. And we're going to write on here, a breech birth. And we're going to start this patient. Right here. At the age of 5, it fell on the head. At the age of 12, football injury. At the age of 20, auto accident. And now they're 32 years old, and they're going down on the sled. They're on the ice. Okay, how many neurological deficits, Elliot Sigel, does this person get for that birth injury?
1.
1? You're not in my ballpark. Now,
What do you mean, how many
neurological deficits. How long do they have an atlas subluxation?
Oh, 32 years.
32 years, so they get 32 neurological deficits. Lori, how many deficits do they get for that fall on the head?
27.
27. What's the matter, Mike? Ain't they working out there today?
I don't know. They supposed to be?
Well, I was bragging. I said, boy, that Mike's out there, he probably has half of that deck up by now. And then he comes in here, staggering in here at 12:30. How many neurological deficits do we have for the football injury? 20? How many do we have for the automobile accident? 12. "91 neurological deficits." From what I told you, which symptom is he probably in our office for, caused by which accident?
Most recently.
Huh? Which accident? The auto accident is the one that he's been monkeying around with for 12 years and nobody's ever fixed it. These things back here are causing other things that we'll find out that he has, like allergies, bronchitis, he gets colds frequently, might have a trace of sugar, all kind of things, but that's come back here. But what he's interested in is those headaches and backaches that he's had for 12 years from the automobile accident. So we have 12 neurological deficits there is very, very important to us, because we want to get him out of pain. Okay, so he has 12. We divide it by 12. It's going to take us 1 year to get him back to the automobile accident. So I'm telling him, look, I'm going to need a year to get you straightened out for this automobile accident. That year is going to be fairly intensive. I'm going to start you out with 2 times a week until I have you out of pain. As soon as I get you out of pain, I will start cutting your visits down. So you have to give a patient a goal. If you tell a patient, look, you're going to be with me 91 months, forget it. 1 month for each deficit, forget it. He's not going to listen to you. So you cut it down. I'm going to get rid of your pain. I'm going to get you back to where you can function properly. I'm going to do that in a year. Now, you're not going to have to come twice a week for that year. I don't know. What I'll do at the end of the first month, I will reevaluate you, and then I can give you a better idea. Right now, the thing is, I got to get you started. So I'm asking you to come in here twice a week for 1 month, and then at the end of that time, we will decide if we can drop you down to 1 a week or whatever. So I want at least a year. And when I do that, I'll bring you back to there. Now, it's going to take me some time to do that. You're going to be 33 years old. Now, do you want me to stop there? Or do you want all this other stuff that I found, like your bronchitis and all this, straightened out too? If you do, it's going to take me a little bit more time. Now, keep in mind that I will be working on all of these things at the same time that I'm working on this. So I'll be able to reduce this down to 8, I'll be able to reduce this down to 15, and that right down. All these are going to be reduced down because I'm not going to work on one thing at a time. I'm going to work on your system all together. We now have him down to 43 deficits. So what we'll probably need from you is a total of probably 4.5 years if you want me to get you back to here and then bring you up to here where you will be running parallel to Utopia. There is no way I'm going to be able to get you back up here. But I definitely will get you up to run parallel with that. And definitely change this. So the decision is yours. The first year, the first month's going to be very intensive. The first year we're going to start, so by the time we get you over here, I hope to have you coming in only 3 times a year. But we'll worry about this, and I will keep changing this as you progress, because I've never had anyone strictly like you before. So I can't really predict. I only know this, that I can do everything that I told you. But it's going to take one thing on your benefit. You're going to have to give me some TIME. That's the answer. Whatever you want, I'll be happy to do for you. That's it. Now, if any of you have any questions, go right ahead and ask me if you were this patient. Yes?
What is the long-term effect of that breech birth? I mean, what is it about the breech birth that...
Well, you have a subluxation on your spine that's been sucking life out of you ever since you were born. You were started out in the hole. Somebody's asking you to fight a battle, and they don't even have you on level ground. It'd be like me and you boxing, and you starting out a foot down. See? I'm going to box you, but you're in a hole. I'm going to put you down in the hole. You're not allowed out of that hole. So I can run all around you and hit you on top of the head and everything, but you have to stay in the hole. That's what your life, that's why you've had all these problems all your life. That's why you were more susceptible to colds. That's why everything has gone wrong in your life.
So everything from cervicals to sacrum and pelvis.
Yes. And that's what we expect from you, and that's what you can expect back from me. And that would be how I would do that patient. Now, you give them their chart. They have a chart, and they take it home. And the wife or somebody says to them, see, these lines here will all be dotted lines. This line is a straight line. From here over, what does that mean on a road map? The straight lines have already been completed, haven't they? And what's dotted lines mean on a map?
Wheel construction.
There's unpaved roads or roads that we're working on making 4-lane highways out of. Well, that's your life. That's where you are to date, and this is what I have planned for you. But the decision is yours. What do you want? Doesn't matter. That's the way I explained it. And if you explain that to patients that way, then when they go home, they show their husband or wife, well, what did the doctor say? The doctor said, I'm dying. Hey? I didn't say anything about him dying. But I gave some pretty good illustrations of what's happening to him, didn't I? Now, I circle what his neck looks like. And at one time, I had plans on making stamps and have the guy keep this. But of course, chiropractic, I think probably sold about 50, and that was the end of it. I mean, some people, they're just not interested. They want to go and pay $30,000 to someone to teach them how to be successful. But the word is cheap. See, this is honest. I can take anybody and give them their lifeline. One time when I was in Florida, they brought me a movie producer in while I was doing a seminar like this, and they brought her x-rays with them. I knew nothing about her except she was in an accident the day before. I said, you had your check with your mother. She had to have a difficult birth with you. I don't have to check, Dr. Pierce. My mother was in labor 35 hours. That's tough. That's tough on the mother. That's really tough on the baby. You had a fall somewhere between the ages of 3 and 12. See this scar in my head? I was running through the kitchen, and I tripped over something, and I hit right on the corner of a table. That's this. You had an automobile accident some 10 to 15 years ago. 11 years ago, I was in a car accident. And then I said, of course, you know, because, and I know, because you just told me you were just in an accident. This is your lifeline. This woman wanted me to come on TV and do people's lifelines. And I was going to do it, but that's when I left Florida and came here. But you can predict what's happening. You use the arthritic rules, you use your ponticulus posticus, you use all the things that I gave you, and you can do anybody's lifeline. And I have never met one person in this world who wanted to be below that line. I went in a man's office one day and sold 12 years of chiropractic to 3 patients. told 1-3 and 1-7 and 1-2. Just like that. Because I explained it to them. But education is a time-consuming thing. But this is much, much better than showing them movies. It's much, much better than doing anything. But you do this, and you will sell your patient on chiropractic. You should do that the second time in. The first time in, your job is to explain the x-ray briefly and get that patient adjusted as fast as you can. Now you take that woman with the spondylo. Second day back, she brought her husband. Now this guy's big and ugly. Now he's about as big as Mike and about as ugly as Elliot. And he comes in, he says, "Where's this guy that stole my wife's affection?" And I said, "It's me." He said, "Doctor, now this guy had a smile on his face this big. 4 years without any?" "How are you, Dr. Pierce?" He said, "You have changed my life." I couldn't understand why the guy smiled. He said, "When my wife come home yesterday," he said, "she got home about 1 o'clock. He said, she went to bed. He said, at 6:30, I'm getting hungry. She's still sleeping. So I wake her up." He said, "When she's up, she's like this." He said, "It was just like she was under a heavy drug of some sort. See, she's repaired." He said, "She don't have no more pain." He said, "This is unbelievable." Okay? Now was the time for me to sit down and explain this to him. Because now I have him there too. Then I can explain it to him. But of course, when you take somebody 17 years of pain away from them, you don't have to explain. You don't have to explain nothing, really.
Doc,
Yeah.
I can't see it too well from back here, but it looks like there's a clock or something above the line. What are those other drawings?
It's ticking. It's ticking your life away, is what that is. Well, I'll tell you what, turn the lights on, I'll tell them what the different things are in there. Right here we have a hydrocephalic baby. Here we have somebody being wheeled. We have people with scoliosis, people who are on crutches. And these people die, usually around 40 years old. Up here, we have people, this is a clock ticking away. We have a person with all kind of question marks coming out of their head, which means Alzheimer's disease and stuff like that. And we have a nursing home here. And we have a guy sitting here looking at TV. And this is a person in the hospital room. Over here, we're explaining x-rays and we're reading spines. That's basically what's on there. And there's different sayings on here. As the twig is bent, so grows the tree. Cervical subluxation. The spine is your lifeline. Scientific spinal analysis is vital. Birth defects, birth, health, and youth line. Existing living line. Pelvic subluxations. And utopia living line and existing living line. Most people do nothing in life but exist. They don't do anything but exist. And it's your problem to put these people back to living.
Doc, if you're concurrently taking 12 years off of those other neurological deficits in the first year, and wouldn't you also be taking 12 years off concurrently in the second year while you're doing 12?
Well, this thing is arbitrary. All it is to show them how long they've been sick. And then you sit there and you tell them how long it would take. You tell them you're not going to be coming twice a week, you're not going to be coming 3 times a week. At the end of that time, I hope to have you down to 3 times a year. But what I'm telling you is it's going to take me some time. Not necessarily a lot of visits. It's going to take time.
At the end of that first year, you're talking 3, 4 times a year
No.
at the end of that.
I don't know. I told him that I'm going to keep reevaluating, I'm going to keep changing these things as I go. All I want to do is get them under care for 1 month. After that, if they don't listen to me, I'm the guy. I don't get the job done. See, my job is to get the patient in the office and get them through that first month. When I get them through, these other numbers become arbitrary. See? But what you have to make these people understand, I told a guy the other day, he came up with John Reader. And this guy, you know, he don't have time for nothing. And I pointed right to the tombstone. I said, you'll have time to go there, buddy. I said, no, I'm telling you something. If I was John Reader, I wouldn't even talk to you if you, I forget how many years I told him I'd want. His fifth cervical was totally eaten away. Okay? I said, if you're not interested, I'm certainly not interested. You know, I said, your problem is you don't want to listen. You don't want to believe. You believe that your tires on your car is going to last forever. I'm telling you, you're ready to have 4 blowouts, mister. So, I don't believe in scaring people. I just believe in telling them the truth. I used to have a graveyard right behind my DeVosburg clinic. When they started that stuff, I'd just pull up the blind. I said, none of those people over there had time either. I said, that's where you're going to go. See, but then I come back to him, I say, I want to tell you something. I don't give a damn myself. I don't care what you do. I said, if you think you're in here for my benefit, forget it. I don't need you. I'm only practicing chiropractic for fun. I need aggravation from you? No. But I want to tell you something. If you don't listen to me, 10, 12 years from now, when you're over in some of these places, I want you to remember the funny little guy. He'll be there pointing the finger, saying, I told you so. I said, because I've done this enough to know where you're headed. It doesn't matter to me. Do whatever you want to. I threw probably the richest patient I ever had in my life out of this office right down here. Because I had his curve fixed and he went to another chiropractor that cracked his neck and reversed it again. Out of here. I have nothing to do with you anymore. I want you out of here. That's final. And I walked away. About 2 hours later, he came in the office, and the girl said, Sheldon wants to talk to you. What do you want? He said, you're right. I'm begging you to take me back. I said, okay, mister. I'll take you back. You're going to listen to me. If you ever do this again, you're out of here. You know what? This man has 80 employees. And every time he comes down here now, he brings one of them, and he pays $1,000 for me to take care of him. So far, he's brought 2. After I threw him out of the office. You know what the trouble with chiropractors are? Everyone told them they're second-class citizens, and you know what? They believe them. Oh, buddy, I tell them, when you're talking to me, you're talking to someone who's done all this stuff. And I said, I was in Japan, and they brought me this woman, and she's telling me about all the good doctors she went to. Been sick for 9 years. And I'm trying to explain this to her. And she's talking. I reach right over and hit her right on top of the head. I said, you shut up when I'm talking. You shut up and you listen. And then she started again about the jar. I said, look, don't you understand that I don't give a shit what they said? They've been monkeying around with you 9 years. These great doctors. 9 years. And you want me to hear what they think? I said, they failed. I'm not interested in failing. Don't you understand that I think what they said is just plain bullshit? Then I adjusted her. Not only did I sell her on coming to South Carolina, I hope she don't come because she's a real But I also sold her a round house. I talked about the clinic, and I sold her one of them. See, in my spare time, I sell houses. But you gotta make these people understand who's the boss. In my office, I tell them, there's only one way, and then I point to the cup. It's my way. And then if they don't understand that, I have this already done. And it used to be in my clinic there, and I never did hang it up down here. But the words of my way is framed, and there's pictures of everyone that ever sang it on there. And if they don't understand the cup, I go out there and say, read this. This is how we work in this office. There is no other way. You either conform to the laws in here or you don't come in here. And they get the idea. Keep this in mind. When you start out in practice, you should do nothing but educate. Educate, educate, educate. And when these patients are starting to get well, you say to them, look, what's with you? Don't you like the care you've got here? Don't you like me to be here to take care of you? Oh yeah, I'm happy. Well, you don't act like it. Why? You have not sent me one new patient. I want to tell you something, mister. If you don't send some new patients in here, the next time you get sick, I'm going to be here. I'm going to be starving. Because I'm going to have to discharge you. Now, you're going to just keep sending the check in there every week? Or are you going to send me some patients? See? Now, people tell you should never do this. I always do it. And she comes in, she's sitting here crying. Dr. Ferris, my life's over. My life's over. I used to be the best cook in the world. I used to make puppets. Now I can't do nothing. I'm just so sick. I'm going to get you well, baby, but I want to tell you something. The first cherry pie you make is mine. Because then I will see how good of a cook you are. Now, come on, let's get with it. Because you just met the guy who's going to get you well because I like cherry pies. Not because I like you, but I'm going to get you well so you can make me a cherry pie. And see, right away, these people feel very, very comfortable with me. Because that's the way I treat them. You'd be surprised how many patients come up and work on the clinic for nothing. They're paying me $1,000 a week to be here, but in their spare time, they're doing therapy up there on the roof and stuff like that. Pounding nails. That's their therapy. Okay? That's physical therapy. I don't have no physiotherapy department, but I have a physical therapy place. But you get them excited. You get them well. See, a person who's sick needs comfort. A person who's sick does not need to be scared. You scare them to a point, and then you reverse it. This is your problem. Now, that's the bad news. Now, the good news. And I found this from the hospital. Right next to me in the hospital bed one day, there was a guy that they did surgery on. And the guy, knife slipped, and the guy cut the guy's penis clear off. And he come in, he said, I got good and bad news for you. What do you want first? The bad news. Well, during the surgery, when I was circumcising you, the nurse goosed me. And the scalpel slipped, and I cut your penis. He said, my goodness, man, what could be good news after that? We sent it to the laboratory and it wasn't malignant. When you talk to your patient, the first thing you do is tell them what their problem is. Then the second thing you tell them is the good news. The good news is you have no pathologies, which means you don't have any disease in your spine. Your spine is totally normal structure-wise. And otherwise, the house that you were built with all has good tuba for your stuff. There's no termites in it. And the very best news is everything that's wrong with you is I am the man who invented ways to correct it. So you're going to be in a better place. Now, you're not all going to have the option to say that, but you can all do this, and I certainly will never care as long as you're doing it right. You can say, you see all this stuff? It wasn't compiled by me, but I interned with this man. I worked under this man. Every one of you have worked under me. See? I am a member of the We Care organization that produces all of this stuff. So, I am in contact with the man who invented all this stuff. If I have any problems with your case, I have him free. His advice for you will be free. And here it is right here. Here's my advice. Now, you know, there's all type of questions that come up along the way. And one of them you'll find is this. The patient will come in. Well, doctor, you just took x-rays last year. Why will I need x-rays again? Well, you turn to this page. Why do you need to take new x-rays when a patient presents with new problems? This film was taken on August 9th or whatever it was. And this film was taken on November 25th. In 2 months, this patient's bones are totally ate away. Now, this could happen to you. I'm not saying it is, because I don't know. But if I would have adjusted this person, I would have caused more damage and I would have done good. So I got to know. Because if you want to take a chance on this being in your body without me knowing it, I don't want to. Period. So that's for that. And then also in here, you can say to them, how important is this curve? And I ought to put another one in here. I ought to put the one in here of my sister who died at 44. But you go to this page back here, and you say, see that? That is a spine of a man 99.10 years old. His spine still has the perfect curve that I'm trying to tell you you need. See? The reason he lived to be 100 years old is because he had this curve. You don't have that curve. You have one like this. So I got to make it like that. If you want to live a long life, that's what I got to give you. I got to give you your life back. And then, well, doctor, can you do that? Well, certainly I can. And there's pre and post in here. Now then, when you're smart and you start getting pre and post, you say, these are done by the man that taught me. But these are the ones I did. This patient today, this one right here, you were sitting right by him in the office today. And then, that patient who you put their picture in here, patients make you patients. They sit out there in a waiting room. And they tell people how good you are. And then she's going to say, you know what? I'm even in the doctor's book. When you go in there, you tell him to show you my spine. But now they're proud. See, they made the hit parade. But then there's some pathologies in here. And probably one of the best ones to show people is the normal cervical, the normal dorsals, how they should turn. And this book's wrong. Somebody got this one in here wrong. The first two pictures shows you how the dorsal should curve. The next three pictures shows you a man whose spine, the dorsals are way right. Turn them to the left, they're way right. Turn them to the right, they're way right. And then if you just look down here, you'll see wires. This man had to have open heart surgery because he had a subluxation like this. That's the same subluxation you have. The subluxation you have is pinching nerves going to your heart. Now we need to correct that. So that's what that's all about. That was nice, I was getting down and back.
Dr. P, talk about this neurological diversity chart. Do we know why it's one and neurological diversity use of relaxation?
Because I said so.
No, I thought you had like your own.
That's what it takes. It takes. See, no patient ever asked me that question. See, when you're an authority and you tell people you're authority, they don't question you. Even when I go to court, I'm interviewed. It takes them about a half hour to qualify me. And usually by the time I'm getting qualified, the attorney will say, that's enough. We believe he's qualified. They don't ask any questions. You know, whenever I'm interviewed, you know, they tell them that I teach at 3 chiropractic colleges, that I have U.S. government patents. I spoke at the 88 Olympics. I have designed x-ray machines. I have designed adjusting equipment. I have designed techniques to correct spines. I do all this stuff. So see, it's important to you to build up something besides sitting there saying, well, I graduated from high school and then I went to Sherman College and now I'm a chiropractor. Better get some more stuff going for you. See? So when you get up there, you have something to say. I've taken postgraduate work. I'm certified in video fluoroscopy. I interned at the We Care Chiropractic Clinic. Stuff like that. See? It doesn't mean nothing, but it's words. See, it's words. As long as you're up there saying words, they're putting it down. Well, this man does have some qualifications, doesn't he? But you'll get these, but you need to have these things built up. Any questions about that? We'll do these few slides. Turn the lights off. A humble beginning. It doesn't matter where you start, as long as you start with good equipment. And the thing that impressed my patients when I was in this little building, hey, Dr. Pierce, you have some of the finest equipment I've ever seen. I remember the last chiropractor I went to. He had a table that the headpiece kept coming apart. And he would say, would you hold this closed while I adjust you? I mean, these are true stories. Or Dr. Pierce, am I glad my mother picked you instead of that chiropractor with the dirty drapes on his man? And that's what it was, people. A receptionist room, and my receptionist sat right in the office out there with the patients right here. The chairs in here cost me $12 a piece, is all I paid for them. Back here, I had a brand new Thompson tape and a brand new calligraph. And over here, I had a brand new x-ray room. This was my 5-in-1 room. That was my private bathroom. That was the men's room. That was the ladies' room. It was the changing booth. And it was the developing room. The 5-in-1. And I worked there for 23 months. And then I moved across the street to this building. And 2 years later, I built this building. I had a printing company downstairs, and I had an attorney here. My secretary, she had excuses when it snowed. She couldn't get to work. She'd be late, so I built her an apartment. Then I'd shovel the walk. Now that she's older, you'll find out what I did for her. But I took away excuses. People always have excuses. Now, I don't know what Mike Gode's excuse is for coming in here at 10 o'clock in the morning. I mean, that would be interesting to find out. I built this clinic. Most practice building courses will tell you have a small clinic with a few people in it and everyone will think you're busy. My philosophy is have one hell of a big waiting room with a lot of people in it and nobody got to think. I had 7 adjusting rooms, and my 5-in-1 room became 5 rooms. Private lab, women, men, dressing, dark room. And I did have a big waiting room. And I'll show you how involved in chiropractic I am. This picture was just taken at random. You remember Judy, who was at our seminar this weekend? That's her dad sitting right there. She's now a chiropractor. This woman's son is now a chiropractor. This woman's son is being a chiropractor. And these two kids right there, I think they were writing the South Carolina State Board that day. And then I went up a floor. Today, when you come into the Vosburg, there is no doubt in anybody's mind who the most important person in the Vosburg is. Now, I hope that I can do this up at New Prospect, maybe, the home of We Care Chiropractic Clinic and Research Center, because I'll put New Prospect on the map the same way I put the Vosburg on the map. A guy told me one day, he said, you know, Dr. Pierce, I'll know that I have it made if I can do what you have done. I got off the airport, in the greater Pittsburgh airport, he got off a plane. He went to the limousine desk, and he said, I want to go to 209 Richland Avenue, the Vosburg. And the guy said, oh, you're here to see Dr. Pierce. He said, then I'll know. But, oh, these signs here are great. They're like turnpike signs. They glow in the dark. And that cost me $1,500 to put up 5 signs. And everybody knows. The MDs must like that. Then I built the building in between the two buildings and went upstairs. See, the secretary was getting old, so I put a roof all the way around so she didn't have to walk out in the snow anymore. And we have a flagpole, just like the one we have up at our place up on the lake. And we care chiropractic clinics, where everyone can afford routine examination. Okay, break time.
Michelle.
Going up?
What?
Going up?
Have to get your lesson.
Exercise.
Where are you going? Where? Ping pong.
Late morning, bro.
Yeah. The technique, and then this afternoon we'll go up to the clinic and we will, up to the building where we have a lot of tables, and you can set up on people and see if you have the proper line of drop and all of those things while we're doing, and know just how to do these contacts. The adjustments of chiropractic is not the important thing. Anyone can adjust the vertebra. The secret is to pick out the right one you want to adjust and then adjust it. It doesn't matter if you're toggling, if you're diversifying, you're using an instrument. If you do it specifically, you're going to get good results. And when you just grab people's neck and crank them anyway, occasionally you'll hit something right. But the thing is, if you was the patient, would you want someone to guess on you, or would you want it done properly? That's what you have to realize. Do we going to do it properly, or what we're going to do? Maureen, if you're going to teach, why don't you teach the entire class here so they can see what you're doing too? Tell them what you're doing. Yeah.
Well, we're going to do a free grant on this guy because he was checked yesterday and teaching him how to use it. What he's doing is, like Doc had said, with a star, you can set yourself up.
Now the patient is already doing something wrong and the doctor's letting them.
Right.
Patients will want to help you and they'll start tipping their head and twisting their head. There's nothing breaks me more when I'm working with an intern if he lets a patient control that reading. That patient's head should stay straight. And when I'm personally doing a patient, I say, look, I don't want your help. I'm the one getting paid. I'm greedy. I'm going to keep all the money. I'm not going to share it with you, so don't help me. And don't you help them interns. because then you get bad readings.
Dr. Pitt,
Yes,
do you use the chairs with the supports in the back to keep them straight up?
do I use what?
I've seen the chairs with those steel.
No, I wouldn't want those things on the back because it interferes with me. I had them tables and chairs and I took them off. A bench is perfect. But what I had in my DeVosburg office is posture constants that would hold the patient's head. And we are in the process of making it an adjusting chair. And when we're doing the instrument, the chair should come up like a barber chair. We're actually trying to figure it out. When I do the occiput, they'll be here, and then it'll move up, and I'll personally stay in the same position with the adjustment.
And the chair will move under,
The chair will move up.
so that'll take out some inaccuracies, you figure?
We just figure it'd be better and easier for us.
Should you be sitting down or just holding it?
No, I'd be standing up.
It has to be like high up.
Well, it should
Oh
go
yeah,
down.
you need the lumbar bar right there. And go up in the air. That's some guy's idea, whether it's work out. Let's talk about you teaching the class.
Yeah. Oh, drill a hole in the floor with a hydraulic.
For a while, I guess for years, they had that constant glide, they called it. It was
Yes.
one of those riveters.
But see, I'm not talking about this instrument. We are not making a chair for the graphing instrument. It's made for the adjusting instrument, is what we're going to be making it for. Not for the graphing instrument.
Dr. Pierce, when you do the computer adjusting instrument and you do the original one and then you go back and do a pose, is it better to do that flexion or extension or neutral? Because I know yesterday you did sometimes with flexion.
Well, I try to do it cervical inflection. And I try to do all my cervical adjusting setting up because it seems to be a better result. But when I'm doing a post, and I have the patient laying down, if I decide to adjust something else, I will adjust them laying down.
But you always do them both the same way when you do your pre and post.
And not necessarily. I mean, everything is relative. If you do a reading sitting down, the patient the spine's under a lot of stress there. When they're laying down, there's nowhere near as much stress. So the readings taken laying down is not going to show you as much trouble as it is setting up. But, relatively speaking, it'll still be there. If you're going to take the lowest reading, if it's a fifth cervical, it'll still be there. But it won't be relatively as bad.
Bro,
Yeah,
any ideas on a possible chair?
that's what we're working on.
It's killing me.
Yeah, they're working on a chair that will maybe come up as we're doing it. But speaking about chairs,
I was waiting for that.
while we're speaking about chairs, the new clinic is getting ready, you know. And we're going to have a new lecture room. It's going to be very, very comfortable. In fact, for people who don't donate chairs, we're going to take these chairs for them to sit. But we're looking for donations to buy chairs. We're buying $300 chairs. But for you, they're only $150 a piece. That will tip, will have arms on them, will have rollers on them, that you can jack up or down to the height that you decide, and the back will pivot and everything. And there will be built-in benches, just like the UN building, and they'll be up, you know. So we're looking for donations. It's $150, $150 a chair. And then your name will
I'll
be right
send you a check to 2 in the morning.
Okay, and your name will be here. This section donated by, you know. So we'll have about 60 chairs. You want to go up at noon and see it? That's really
What
coming.
about the time frame of some kind of chair? When do you think we might have something like that
I don't know. They're working on that right now.
For the patient or for the doctor?
for the patients?
Yeah. And see, basically what we hope it will be is they'll move up in sync with how we're adjusted. So when you get down to the sacrum, then we'll be able to do everything setting up.
A lot of these big tall guys, I have to get up here and it's, 80 to 90 patients. Hey, I'm starting to have a problem with my dorsals again. The rhomboid muscles, the spider getting the trigger point down. That thing that Pettibone had, is there anything similar to that, but maybe with pneumatics?
Well, that's basically what we're trying to get, something like that. We ordered a couple in, but they were just junk.
We need something there.
Oh, we need something that's going to last. I think we're going to have to build it, and they're working on that. But we're working on so many different things at the same time, it's almost impossible. But we have Mitsubishi interested in doing them for us. I was over in Japan, and they went crazy when they saw this. And they feel that they can do it even better, and I'm sure they can. Now, of course, Joe Evans don't like to hear that, because he thinks he's the greatest engineer in the world, and he might be. But I told him, I said, what's wrong with having other brains? Because I don't care who you are, there's always someone out there that maybe you have a better brain, but they might have a better idea. And when they give you their idea, the guy with the better brain can take that idea and make it 3 times better than the guy's original idea. See? And that's the secret of something like this. But everybody's always concerned who's going to get the credit and who's going to make the money. But when I was in Japan, I spoke to 17 doctors. 15 of them wanted an instrument now. I'm willing to pay $30,000 a piece, where we get them for, we sell them here for 25. Right now. I've never hit a percentage like that on anything when I speak to here. So Korea's calling me. They want me to come over there again and show the thing. So if we could sell 5,000 or 6,000 instruments over there, if Joe Evans only made $300 or $400 a piece off each one, it's found money. So I finally told him, I said, look, I don't care, because this ain't the way I make a living. I don't care.
How many is he producing?
Oh, hell, I bet you we don't have 10 here. Plus, not only that, we got to speed up the ideas we have. If you had Mitsubishi, they could put 10 engineers working one each on a program, and before the end of the year, we'd have programs that are unbelievable. See, plus, if I could sit down with a bunch of engineers, see, engineers are smart, they don't always have ideas. But when you give them an idea, they sure know how to make it work. And Mitsubishi got a lot of money. And then, of course, everybody worries, wonder if they give it to another profession. There's so damn many sick people out there. If we gave it to another profession, our profession would probably be better. Because, anyone, it's like Joe Evans says, wonder if they get the idea and run with it. Number one, you have to have someone that knows how to make it work. See? Like I've had a lot of companies that did dermathermographs for me, and then after I quit dealing with them because they were cheating or something, they all came in competition with me. They all failed. You know why? You have no one that could stand up in front of the classroom and sell it. You can make whatever you want, but you have to have someone be able to get across to you how to use it. See? A lot of people just think, oh, you grab that and now you don't need no x-rays anymore, you don't need nothing. You still have to think.
If you don't use this right, it's useless.
It's worthless. And, what do you do when you have 11 down? You're going to tap them all? No, you're going to look at your visualizer, you're going to pick up. Now, here's what I found. I don't know if you've been finding this or not. But sometimes I might find I want to do 5th, but the instrument will say do 4 and 6 first. And then after you do 4 and 6, then the next day, you got to do 5th. And the results are much better. So, I think the subluxation, like a 5th cervical, the subluxation could be between 5th and 4th. It could be between 5th and 6th. It could be between all 3 of them. And sometimes you might have to get these 2 before you get this one, You know, we always say do the last things first. When we see something, we go right to fifth cervical, don't we? But that is not where did fifth cervical come in that line of going up? Came first, didn't it? So really, what I found on some cases is I have to hit the first dorsal first. But those are the things that went out last. So living with the same theory, how do we want to correct subluxation? We want to correct the one that lasts first. This more or less sometimes gives me a protocol that I don't go the same way that I normally did.
You do ask.
Thing that impressed me most about mine is, you always told us those lumbars, don't worry about them. They're cervical related, and I'd see the lumbars down around the 2, all of them. And we'd correct, but the sacrum would be up. And we'd correct, work on the neck a while, and all of a sudden those lumbars come all the way to the top and they stay there.
Yeah, without you even
Now, from
touching.
then on, the sacrum's going up
Yeah.
without even having to touch it.
Yeah.
I thought.
I mean,